It's too bad the United States was spending all its time pursuing hydroxychloroquine and chloroquine as COVID-19 cures. This was at Donald Trump's insistence, but it just didn't pan out. Britain, though, has also been searching for a cure, and they didn't stop at the first one they found. They have found success using a common steroid, dexamethasone. It leads to reduced chances of death. Scientists at the University of Oxford said on Tuesday that this inexpensive steroid reduced deaths in patients with severe COVID-19. Once the drug is fully put through all its paces, if it pans out, it would be the first treatment to reduce the number of deaths in severely ill patients, the opposite of hydroxychloroquine, which was proven to lead to more deaths. The researchers estimated that had dexamethasone been used on all the sickest coronavirus patients in Britain since the get-go, that it would have led to 5,000 fewer deaths. In the more severe cases, COVID-19 attacks the cells that line a patient's airways and lungs. However, it can be just as harmful if it prompts a large immune reaction. Some form of oxygen is needed by 3/4 of the COVID-19 patients who are hospitalized. Dexamethasone appears to reduce the inflammation that the immune system causes, which protects the tissues. In the study, it reduced the deaths of patients on ventilators by 1/3 and reduced the deaths of patients on oxygen by 1/5. Assuming that when it goes through peer review it stands, and these are well-established researchers, it's a huge breakthrough, a major breakthrough, said Dr. Sam Parnia, a Grossman School of Medicine at York University professor of medicine and a pulmonologist. I cannot emphasize how important this could be. Not everyone is ready just yet to get really excited, as there have been a series of crushing blows in the rush to find a coronavirus treatment. While UI hospitals were treating COVID-19 patients with dexamethasone on Tuesday, US experts wanted to see the data from the study. It's just one day after the FDA pulled the emergency use authorization for hydroxychloroquine in the US. The only other successful drug so far has been the antiviral drug remdesivir. But it only shortens recovery time. It will be great news if dexamethasone, a cheap steroid, really does cut deaths by 1/3 in ventilated patients with COVID-19, tweeted Dr. Atul Gawande, a surgeon and author, but after all the retractions and walkbacks, it is unacceptable to tout study results by press release without releasing the paper. Dexamethasone is the first drug to be shown to improve survival in COVID-19, said Peter Horby, a professor of emerging infectious diseases at the University of Oxford and one of the trial's chief investigators, in a statement. The survival benefit is clear and large in those patients who are sick enough to require oxygen treatment. Horby also said dexamethasone should now become the standard of care in these patients, as it's inexpensive, widely available, and could be put to use immediately. Now for the parts of this story that has people bringing their feet back to earth. The steroid was not studied outside of the hospital and was not beneficial to patients who were not on respiratory support of some kind. There was a fear by many doctors that dexamethasone may actually make infection worse by preventing the immune system from attacking the virus. While Parnia had treated patients with steroids and seen some improvement, there had not been such a large trial comparing no steroids with steroids. Additionally, corticosteroids like dexamethasone were used during other coronavirus outbreaks, SARS and MERS. Those outcomes were not successful. There was a much smaller trial of dexamethasone on COVID-19 patients in Spain. The results showed it may reduce the amount of time patients are on ventilators and may reduce deaths. It does not sound like the results were conclusive. Britain's Health Secretary, Matt Hancock, though, said even without published results, doctors in the National Health Service could begin using dexamethasone as the standard treatment for hospitalized coronavirus patients. 1 day of treatment for one person costs less than $1. Hancock said that several months ago the government began saving up dexamethasone and stockpiling because of the signs that it could help. Now Britain has 200,000 doses ready to go. The clinical trial was randomized and controlled. About 2,100 severely ill patients with COVID-19 were given low doses of the steroid, either by mouth or once a day. Their results were compared with those of the 4,300 patients who received the standard care. What this is effectively doing is tamping down inflammatory responses in patients, said Stuart Neal, a King's College London professor of virology. It's almost certain this is affecting the body's response against the virus rather than inhibiting the virus itself. Dr. Stephen Griffin, an associate professor of virology at the University of Leeds, feels it's important to study dexamethasone used at the same time as antiviral treatments such as remdesivir. The ball is now in the FDA's court. After they withdrew emergency use of hydroxychloroquine and chloroquine, it will be up to them whether they rush into using dexamethasone based on Britain's study or if they embark on their own study of the use of the steroid.